to dental school, I pretty much knew I wanted to be an orthodontist, which is a little bit of a plunge because when you go to dental school, you don't know if you're going to make it into that specialty. You're taking a chance, and so I worked very hard, made it through dental school, did very well in dental school, and made it into an orthodontic program right out of dental school, and a very good one in Houston, and was very, very blessed to be able to do that. And it's designing smiles, so you're very creative in terms of how you have to look at someone. You have to think about all the features, their facial features, their dentition, all the aspects of how they look, but also you have to, and kids especially, be able to envision where things are going to go on, how are they going to grow, what's going to happen in their facial features as they get older, and planning for those things. So it's a three-dimensional, fourth-dimensional kind of thing where you have to think 3 dimensions on how their smile is and what's going to be like down the road and when time changes. I like seeing all different groups of people and all different types of people and
ages and
all ages. From I think my oldest patient was in her 80s. So and then I have young ones. So just a very interesting seeing different perspectives and different ways people look at things and engaging with people. It's important to me every day to make a personal connection with the people that I'm working with, to really let them know that I'm concerned about them, not just their mouth, but them as a person, and to make that personal connection with them makes all the difference in the world. It also makes a difference in how they react to your treatment. When you show interest in someone, they are much more likely to cooperate with everything you're asking them to do. And some of the things we do are not the easiest things. Some of them cause discomfort, or they're take some real work on the patient's side. And so I think motivation is a lot easier when you make a personal connection. I mean, think about the smile. The smile says so much about people. It's their expression that communicates warmth and love and joy, and so just the fact that we're working on that is amazing, and seeing someone after having completed their treatment years later, sometimes I'll run into patients out in the grocery store, and I've run into people in the airport in other cities even, and when they smile, it really is something that makes you feel good.